Hello and welcome to my week 7 video. In this video, I'm going to be going over how to set up for a liver and abdomen scan, as well as a scan of the pelvis. I'm going to be talking about how you are going to set up for these scans, what coil you're going to use, the landmarks you're going to be using, as well as slice, angulation, and coverage. So I'm just going to go ahead and get right into this video. First, we're going to start off with how to set up for a scan of the liver and abdomen. So to do this, the first thing you want to be doing is demetallizing yourself. So this includes removing your phone, keys, wallet, anything that could interfere with BO. You want to make sure is locked away before you enter zone 4. After this, you want to be checking the doctor's order. You want to see the patient you're going to be seeing, of course, their first and last name, date of birth, the ICD code, and the order is signed off by the doctor. After this, you're going to set up your scan room. So this includes sanitizing the scan room table, the coil that you're going to use. The coil you're going to be using is a phased array abdomen torso coil. You want to make sure that there's fresh linens on the bed and that the table is lowered to the lowest setting. Again, the coil that you're going to be using is a phased array abdomen or torso coil. You want to position your patient supine with their arms above their head. This is to decrease the factor of a wrap artifact. Your patient can either be head first or feet first into the scanner. It'll all depend on what type of scanner that you're going to be working with. So since the patient's abdomen will be at ISO center for the entire duration of the scan, you want to let them know that they will be having to hold their breath several times throughout the scan. Again, the purpose for them holding their breath is to decrease the occurrence of a wrap artifact. So once your patient is comfortably positioned with the coil, you want to go ahead and set your laser landmark. You're going to set this at the xiphoid process of the sternum. Another important note with the scan of the abdomen is that you're going to be using a respiratory belt. So this is going to generate a waveform as the patient breathes. So upon expiration is when the actual image is going to be acquired. The respiratory belt will be placed around the patient's abdomen while you are positioning them. Now, if you're going to be using contrast with the abdomen scan, it is noted that you need to use a power injector to do this for precise timing, because as you breathe, your body is constantly moving, your organs are moving. So precise timing of that contrast is essential. So I'm going to go over the protocols for an abdomen or liver exam. This will change based off your clinical diagnosis, but this is just a basic protocol. It's also important to remember your breath holds, because your liver and diaphragm upon respiration and inhalation will either move up or down. So that's really important to note for your image planning. So first things first, you want to set up your scout localizer images. These are 3 images in the coronal, sagittal, and axial plane. And you want your scout images to include both the kidney and the liver. So another important note when taking images of the liver and abdomen is whether your site will want you to take these images as a free breathing or breath hold. So again, depending on your clinical site will determine what protocol you will be running. So starting off with an axial breath hold scan, you want to plan this on the coronal breath hold scan sequence. You want your slice coverage to include from the dome of the liver to the kidneys. You also want your field of view to include all the soft tissues of the abdomen. For a coronal breath hold sequence, you want to cover all the soft tissues of the abdomen, and you'll also want to make sure that your field of view includes the dome of the liver and the kidneys as well. Now for the coronal breath hold sequence, you want to plan this on your axial localizer. You want to angle vertically across from the liver, and your coverage should include all the soft tissues in the abdomen. You also want your field of view to include the dome of the liver and the kidneys as well. Sometimes the iliac crest will also be visible. Lastly, I'm going to be talking about the axial free breathing scan. You're going to plan this sequence on the coronal localizer image. You want to angle horizontally across the liver, and you want to cover completely from the diaphragm to the C loop of the duodenum. Now again, if you were going to be using contrast to do your scan of the abdomen and liver, it's important that you're using the power injector. This is because it is a precise timing exam. So as you're breathing, your liver and diaphragm is moving up and down either with inspiration or expiration. So again, you don't want to use contrast route via intravenously. You want to be using the power injector because it's precise timing. So if you were to inject your patient with contrast, you want to do this safely, of course. This starts by, again, screening your patient. You want to make sure that they're not diabetic, their kidneys are healthy. You want to make sure that their GFR was checked within the last 30 days. And if it's less than 30, you do not want to inject them with contrast. If you, again, were to inject them, you want to make sure that absolutely no air enters the IV line. This can be done by flushing the line with saline before and after gadolinium is injected. Next, I'm going to be talking about the steps that you need to do to set up for a routine pelvis exam. For a routine pelvis exam, our setup is going to be similar again to our liver and abdomen exam. You want to make sure that you're checking the doctor's order, you have the correct patient, and the order is signed. You want to make sure that the scan room is completely sanitized, the table is lowered to the lowest setting, you have the correct coil, you have fresh linens. You also want to provide your patient with an emergency squeeze ball. Make sure that they have hearing protection, and you want to have open communication with the patient and let them know exactly what's going on during the exam. The coil you will be using for a pelvis exam is an abdomen pelvis/torso coil. You want the coil to cover completely from the top of the pelvis to just under the groin area. As far as positioning goes for the pelvis, you're going to position your patient supine, feet first, into the scanner. Depending at the site you're at, they may tie together or have the patient invert their feet. This is so that when you are running your images, you have a complete and full view of the pelvis. Once the patient is comfortably set up on the table with the coil, you're going to set your landmark at mid-pelvis. Once you set your landmark and the patient is comfortably at isocenter, you are going to set up your localizer images. So your localizer images should include the iliac crest, the ischial tuberosities, and all of the soft tissue boundaries. Starting with the axial sequence, you're going to cover from the iliac crest to the ischial tuberosities. You also want to angle perpendicular to the L-spine. For a coronal sequence of the pelvis, you want to angle between the hip joints. You want your field of view to include the entire bony pelvis, just above the iliac crest to just below the ischial tuberosities. For a sagittal sequence of the pelvis, you want to again cover through all of the bony tissue. Your field of view should include the entire bony pelvis from the iliac crest to the ischial tuberosities, and you want to angle between the hip joint. Thank you for allowing me to explain how to set up and run scans for the liver and abdomen as well as the pelvis.